study itself is more than 900 years old. And greetings from Italian Academy of Rhinology and from the Italian Skull-Based Society. So, we like to start with this sentence of Giorgio Sussetti. Giorgio Sussetti was one of our masters, our maestro, and we want to acknowledge the different features in anatomy we had in the last 30 years. Xavier in Vienna, Francesco Bagatella in Italy, in Parma, in Brussels. We start with our lab more or less 3 years ago. But before that, for 30 years, we go around Europe for the different cities for having anatomical research and anatomical training. So we want to acknowledge the different labs in Europe, like Brussels, ULB, University, Barcelona with Pascalino and the Notaris, Tübingen, and Vienna with the Xavier. When we are dealing with the structure, we have to understand the first thing is the orientation. So when you are arriving here in Varese, you have to know that Varese is on the north of Italy, and then the hospital is in this part of Varese, and this room is at the 4th floor, so from general to particular. So if we go inside the sinuses, from the nostril to the coana, we have to know exactly what there is around. So we have to understand our anatomical landmark in the anterior cranial fossa, so olfactory bulb, the arteries, and we have to know the orbit, and we have to know the floor, we have to know anterior cranial fossa, middle cranial fossa, and posterior cranial fossa, to avoid disorientation. You know, this is a shape of a scar of a suction tube perforating the skull and reaching the third ventricle. There was a man, 30 years old, we operated on more than 20 years ago in Pavia, when we were in Pavia, and there was an inverted papilloma. So first of all, the surgeon should have a combined surgery, because this inverted papilloma was completely inside the frontal sinus. But okay, he started with the endoscopic procedure, but he was completely disoriented and reached the third ventricle. So we accept the patient in the department with a CSF leak, pneumoencephalus, pneumoventriculus. Luckily, he don't destroy, he don't break the artery, so the A1 or A2. So we can operate it on, and the patient still is into there. So we have to understand. Sorry, just a moment. È molto carico. I colori sono molto carichi. Sorry, but it's a new projector, and the color is too dark. Luce un po' rosso, se vuoi. So first of all, we have to understand how is organized the sinus compartment. The first important concept is the common lamella of the ethmoidal turbinate. The common lamella is a sagittal bony plate origin in the beak, the nasal process of the frontal bone, and ended in the sphenoid. So it's a sagittal position, and it's important to understand that there is a line that unifies the lateral attachment of the turbinate. It's the so-called axilla. You know, the lateral attachment of the turbinates is the axilla of the turbinate. So if you drive a line that unifies the axilla of middle turbinate, the axilla of superior and supreme turbinate, makes a very important landmark, because above this line there is the olfaction, the distribution of the olfaction. And below this line you can trim, you can remove turbinates without any risk. And at this point, middle turbinate, superior and supreme, turn and reach the papyracea. If you take a horizontal scan, an axial scan, above this line, you can appreciate three sagittal lines: the septum, the ethmoidal turbinates, and the papyracea. There are three parallel lines. But if you take the same axial plane below this line, you can appreciate an interruption. So there is interruption dividing anterior compartment and posterior compartment, because middle turbinate, the basal lamella of middle turbinate, reach papyracea. So this is the first important concept. When you are doing surgery and you have a completely degeneration of middle turbinate, completely polypoid degeneration of middle turbinate, and you have to resect the middle turbinate, which are your landmarks? You have to see the lateral attachment, the axilla of middle, superior, and supreme, and you can trim, you can cut without any risk. If you go above this line, the risk is to damage the scalp base and have CSF leak, and to destroy the olfactory epithelium. So, the first important understanding for orientation is to understand the division between orbit, ethmoid, and nasal fossa. Three lines: papyracea, common lamella of ethmoidal turbinate, and septum. So you have to able in the lab to recognize, to locate this line: axilla of middle turbinate, axilla of superior, axilla of supreme. Above, only one line. Below, interrupted line, 1 and 2. And you see the attachment of the common basal lamella on the skull is in the angle between horizontal and lateral cribriform. From frontal to sphenoid, the attachment of the common basal lamella is just in the angle between horizontal and lateral. This is very important because if you cut the common lamella, nothing happens. If you fracture the common lamella, CSF is mandatory. So, once again, you see the attachment always in the angle between, in the junction between horizontal and lateral component of cribriform, the common lamella of the ethmoidal turbinate, above the axilla line, only one structure. Below the axilla line, you see the origin on the papyracea, so interruption. The second concept is the orientation of the organization of the ethmoidal nasal structure, divided in anterior and posterior sinusal components. The anterior one is constituted by anterior ethmoid, frontal sinus, and maxillary sinus. The posterior ethmoid, and sphenoid. The division line is done by the second segment of middle turbinate. Middle turbinate has a first segment that is sagittal. We have cut it. Sagittal segment. And then the second segment that starts from the lateral attachment from the axilla of superior turbinate and reach the papyracea and divide anterior and posterior ethmoid. And this is the horizontal segment, but it's not a regular plane. You see in this specimen the shape of the basal lamella of middle turbinate with a recess. So this is still anterior ethmoid, and we have to understand this shape of the basal lamella. Then we have a third component that is horizontal and divide posterior from anterior. So, first sagittal, second horizontal, third axial. Second frontal, in the frontal plane. But we have to understand the recess. So, from the nostril to the choana, we encounter first the head of inferior turbinate, then the lacrimal pathways, and the sac is covered by the agernasi. Uncinatus infundibulum, bulla, and retrobullar space. And then there is posterior ethmoid, superior and supreme meatus, and then sphenoid with the sella floor and posterior clivus. So now we start with the understanding of the anatomy related to our surgery. And FACE means functional endoscopic sinus surgery. So a limited surgery based on microanatomy of the lateral nasal wall and sinus system. So our target, our goal, is to reach the ostia of the sinuses, maxillary, frontal, and sphenoidal. In this surgery, if we can, we don't want to touch the ostia itself. We want to clear the pre-chamber to the ostia, to give to the ostia the maximum of the functionality. So in this case we remove the uncinatus, but we try to leave the rim of the natural ostium of maxillary sinus intact for having to have the better transportation of mucociliary system. If the ostium itself is closed, okay, we need to enlarge. But if not, we like to leave the sides of the ostium intact. So we have to clear the anatomical structure in front of the ostium, so the so-called pre-chamber. The pre-chamber for the maxillary sinus are the structure involved in the osteomeatal complex. The pre-chamber for the frontal sinus is frontal recess. The pre-chamber for sphenoidal sinus is sphenoethmoidal recess. So we have to make a journey with different door with the transethmoidal approach. I just say you encounter first the inferior turbinate, then the lacrimal pathways, the head of middle turbinate, and inside processus uncinatus, infundibulum, bulla, retrobullar space, basal lamella, superior meatus, supreme meatus, sphenoidal anterior wall, sphenoidal sinus, and sella floor. We already had the two main structures that divide the organization of nose and sinuses. Basal lamella. The basal lamella of middle turbinate divide anterior and posterior, anterior and posterior ethmoid. Basal lamella. But remember, the common lamella is the sagittal plate dividing the position of the olfactory fiber. So, common lamella of ethmoidal turbinate is a sagittal structures. Basal lamella of middle turbinate is an inclinate